again, everyone. So first off, I just want to say thank you so much for everyone who has been supportive of me and has subscribed and has reached out to me and provided very sweet, endearing comments that I can't be more appreciative of. For anyone who has not been supportive of me, what? Scurry along, scurry along. I mean, I don't know why you're wasting your time here, so. But, anyway, so along to this week's topic, or not this week, but today's topic, I'm going to talk about, so kind of where to get started or in your support system or your treatment plan. So there's a variety of options. Of course, you can go to a psychiatrist, you can do psychotherapy, you can have a therapist, you can have your friends and family as your support system, you can go to a school counselor. There are just limitless options out there for you to take advantage of. So the way that has worked for me, or that I went, is, which I would actually not recommend, is I first went to a general practitioner. Now, I would recommend not going to a general practitioner. I would recommend skipping that step and going straight to a psychiatrist if you can. Now, a lot of psychiatrists may require a recommendation from your general practitioner. So if you already have a family doctor, you may be able to tell them you're having some mental health issues. You'd like to see a psychiatrist, someone who specializes in that field, and if you can get a recommendation. And then that way they can get you into somebody. Personally, I just called around myself. I didn't have any problem just picking up the phone and saying, hey, I want to make an appointment. So that's what I would recommend doing. Either of those two options. Don't go just to your GP. Your GP, they don't have much knowledge on mental health. The drugs that they prescribe are going to be for depression or anxiety, and they're just kind of giving you what they know has worked before on other patients. It's not their specialty. I mean, so why go to them when you could be going to someone who could really be diagnosing your issue? So that's what I recommend as far as doctors go. As far as therapy, if you are a high school student, you can go to your high school guidance counselor. You can start there. Ask them what kind of resources are available. There may be free resources available in your area or through your school. If you're a college or university student, I think all universities have a mental health counselor on campus. I think that might even be a requirement. So you can definitely get help there. So definitely take advantage of that if you're a college student. Now, so that goes for therapy. As far as friends and family, now I know how difficult it is to come out to friends and family when we have an issue. So, well, actually, I'm kind of getting ahead of myself because you might not know your condition. You might not know if you have bipolar disorder, or if you have major depression, or if you have PTSD, or if you have schizoaffective disorder. You don't know what you have. So, let's just say that you've been to a psychiatrist, you've been diagnosed as borderline personality disorder. Now, as far as from my experience, coming out to friends on my diagnosis has been very positive. Even people that I am not particularly, well, people that maybe I've been close with in the past but am not as close with currently that I've told, they've almost acted like, okay, no problem, well, I'm here for you if you need me, so, and that's that. They don't go on about it, they don't they don't feel pity for me, they don't get angry at me like, oh, well, no wonder you acted so this way or that way was because you have this disorder. So I think that coming out to friends is important. Coming out to family also is important. If you have a close sibling, almost kind of like the same kind of relationship you have with a friend. So telling them is kind of going about the same way. They'll probably give you that same reaction, at least I would hope. Coming out to parents can be a little bit harder because you never know how they're going to react, especially when you're younger. I know when I was younger, my parents had a lot of resentment, and they just didn't, they wanted to just fix the problem. I don't I don't know, they thought that it was a lot of like just teenage rebellion and angst and all of that when it really wasn't. It was more than that. It was a real psychological problem. So my advice for that, if you are in that age group, if you are in middle school or if you are in high school, go to your guidance counselor, tell them your worries about telling your parents, and see what they say. See where they say to go from there. Maybe they can get you all in the same room and have a meeting about it. And I know that really helps when you have someone who knows what they're talking about in front of when you're coming out to like a friend or a parent. It really helps the discussion to go in a much more positive direction because you have someone to back up what you're saying, to back up, I have these symptoms, for whoever you're telling that family member or that friend to, for them to actually recognize and understand what you're saying is real and it's not just something that you're making up. So I do recommend that as far as coming out to family and friends. As far as having a support system, definitely your therapist is going to be probably your, I don't know, number one support, maybe not number one. I don't know. That could be a controversial subject, whether a therapist should be number one or if your spouse or boyfriend or girlfriend or mother or father should be number one. It's tough to say. I think it may vary, but I think you don't want to put too much pressure on your loved ones. I know I feel like I've put too much pressure on my friends before as far as coming to them with my problems. So, and I don't know, that could just be me, but I feel like I've made them feel a little bit uncomfortable before just because I have just let it all out, vent it to them, and not really given them any breathing room to take it in and really give me any advice, or maybe they don't have any advice to give. Maybe they're just trying to listen, but they don't have any advice to give, and that kind of puts them in a situation where they don't know what to say because they don't know how to help me. So be careful when talking to your friends, your in real life friends, or your in real life siblings or people like that. For online communities like YouTube, or if you go to like Psych Forums or Psych Central, I think those are really great places where you can vent to people and talk to people and share your experience with. You can make friends online who specifically want to listen to your problems and hear your story and hear about what happened during this day, why you were depressed or why you were feeling anxious. So I think going to communities like that, if you feel like you just really need to talk to someone and therapy isn't enough or therapy isn't an option right now, then you should go that route. So I do recommend that way over just relying on your personal friends and family. So, alright. I think that's all I had to say on that. So, yeah, all in all, first see a psychiatrist, get in touch with the therapist, whether it is a school counselor or whether it is an actual therapist. Oh, another thing I wanted to touch on about therapy is so some therapists don't take insurance. Some therapists may not take your personal insurance, whether it's insurance if you're still on your parents' insurance plan, or if you have your own insurance through your work or your own private insurance. So what a lot of therapists will offer is something called sliding scale, and what that means is that they will negotiate a price with you. So I actually did this with a therapist lately. I think her charge was $120 per session, and she negotiated it down to $75 per session. So that's what that sliding scale means. They'll work with you based on your budget and what you can afford. So that's something that you can look into for therapy as well, if you're not in a school or a university setting where you can get that free therapy. So that, and then the friends and family, let them know, come out to them, lean on them some, don't lean on them too much. Use the internet for what it is. I mean, don't use people on the internet either. They're humans just like you and I are, or just like as if they were sitting straight in front of you, just like if they were real life friends. So don't depend on them too much. Don't put a burden on them. But they're on this psych forum, or they're on the mental health YouTube community for a reason too, because they want to talk about their problems and they want to listen to problems of other people. So definitely take advantage of working with them and kind of, just talking about your problems and feeling better, hopefully. So that wraps it up for this video, and I will see you guys all next time. Please give this a thumbs up if you liked it, and if you do have any more comments or suggestions on what else has helped you, or any other therapy or doctor or friends or family approaches that you have when it comes to your mental health, please leave a comment below and I would love to hear from you. So otherwise, please subscribe, and I look forward to seeing you in my next video. Thanks guys, bye.